Dr. Kevin Kavanaugh joins us now. He's a retired physician, also the founder and president of Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
So are the grandkids still asleep?
No, they just awoke, so no guarantees.
We'll be listening for them. No problem. I guess you've heard the news that the governor came out yesterday saying that as of June the 11th, he's not going to be broadcasting his weekly updates anymore, unless something happens between now and June the 11th that is unforeseeable. That sounds like this thing's over to me. What do you say?
Well, it sounds like it, but I think we still need to be somewhat concerned because of the number of people which are not vaccinated and the fact that we have variants now, these immune escape variants, which are starting to enter the United States.
And one in particular that has you scratching your head is this Indian variant. Tell us about that.
Well, yes, the Indian variant is a double immune escape variant, and let's state right up front that in the United Kingdom, the vaccines work extremely well as far as eliminating severe disease from this variant, so get vaccinated. But this variant is very concerning. The CDC, however, has not classified it as a variant of concern, even though it has two major mutations, not just one. The WHO has classified it as a variant of concern. And a month ago, according to WHO data, this variant made up about 1% of our genetic sampling. Right now, according to, again, WHO data, that variant has jumped to 7%. And I found out this along with the WHO site where it was through the media out of the United Kingdom, the Daily Mail. It's not being covered much here in the United States. And I should add that the WHO data, which you can see from a website called, I believe it's outbreak.info, it is up to date within the last week or so. As the CDC data, you would go back to maybe May the 8th. So it's even more up to date. And that to me is kind of disturbing because this variant does spread very fast, and there is some evidence that it may actually be more lethal than the UK variant. So one needs to be careful. One needs to get vaccinated. I know there's been a lot of discussion of if I've had the infection, should I get vaccinated? WHO, the CDC, and Dr. Kavanaugh says, yes, get vaccinated. The reason is the mRNA vaccines will give you much greater and also more specific protection than a single COVID-19 infection. And to put it simply, the vaccines are extremely safe. You get them twice. So if you had an infection, you're not going to get as big of immune response, or as opposed to getting the vaccine, because you're getting the vaccine twice. That's one of the major reasons. So please get vaccinated. There is some research that if you had the infection, you may only need one jab of the vaccine, not two. But for now, follow public health advice, and everybody needs to get vaccinated.
And your big concern is the fact that the CDC doesn't even list the Indian variant, right? You think they're ignoring it, or what?
Well, actually, last night I found it. It's because the data is 3 weeks old. In other words, older data. It's way down at the bottom of a bar graph, and it's like 1% or less. So it actually was there. Yeah, that was a big concern. But to me, this should be highlighted up top. Indian variant, 1%. Gee, now it's 7%. We need to get vaccinated. None of that is, I don't think, being stressed enough.
All right. Dr. Kevin Kavanaugh, always a pleasure, sir. We'll talk to you on Friday.
All right. Thank you very much, Jack.
By the way, Kevin, congratulate those grandkids. They were really quiet.
Yeah, I know. I'm proud of them. I don't know. They may be hogtied. I have to go down and check. All right.
Thank you, sir. When I spoke with him yesterday, he said, "I'll be glad to do it, but I've got my house is full of grandkids. I can't promise there won't be noise in here."
Oh, wow.
Yeah.